in our embryonic age. There is mucocutaneous junction in the anus which demarks the mucous membrane with the dermis. So in the anus, the dermis will be also there. That's why the part where it is covered by the dermis is highly sensitive, because the anorectal region is guarded by two powerful sphincters. The circular muscles, the muscle cord, they change into the sphincteric area, and both the sphincters are very much powerful, and one of them is controlled by autonomous nerve system and the other one, the external one, is somatic control. There may be many spaces are there all around the anal canal. The spaces are very much important because they are loosely filled by the adipose tissue and loosely filled by the fat globules. That's why they make a cushion-like thing, and on which you have to sit. The patient will be sitting, the persons will be sitting. So that seat is made of very loosely cushioned adipose tissue. The region is highly sensitive and abundant nerve supply is there. Everybody knows. It is so much sensitive. Even a small prick also causes a immense pain for the patient. So that is highly supplied with nerve system, both somatic and as well as the autonomous, and even cranial vagus. It is called, in Ayurveda it is called as Buddhamarma, the Satya Pranahara Marma. So the rectum, it is descending and there is dentate line, and after that they get whatever is there. Can I have this? So the last part, that is actually anus part, and which is covered by the skin. So quickly, so this is generally seen a human anal verge. So this is the pelvic floor. These muscles are there. Whenever you are dealing a case with these many muscles, you have to cut, or these many muscles you have to deal. So you can see that there is arterial supply, the inferior mesenteric artery, that is actually directly supplied from the aorta. So that's why there will be heavy bleeding, and in small cases or small problems also, a small ulceration also, you see that in the rectal canal there will be heavy bleeding, because the bleeding is directly from the aorta. And the other arteries are also supplied, the superior middle rectal artery and inferior rectal artery. So it is abundantly actual supplied. And again you can venous return. The portal system is also supplied, and that's why our people say that for all the anorectal problems, the Agni is the important point, and Agni is the one we have to look after. Then only you can treat properly the anorectal problems. So just I was actually telling the green parts which are seen there, they are the loose spaces where the abscesses can form. The pus can be actually accumulating there. You can see, actually I don't have pointer in this. Is the pointer working? So you can see that it goes beyond the bladder also, and it can sometimes reach the abdomen also. So those loose spaces are not that much equal. So always we should be careful in dealing the infective disorders in and around the anal canal. So that is also an important aspect of this region. So you can see that the three important cavities in our trunk, that is thoracic cavity, abdominal cavity, and last one is that is pelvic cavity. This pelvic cavity is actually related to anorectal disorders, and from where sometimes the disease can even go to the abdominal cavity. So with that few of the anatomical aspects, now we have to take a look at the various causative factors of this. So Guru, Manda, Shita, Abhishandi, Vidai and Viruddhahara. The ahara is the important point by which we will generally get the anorectal problems. Eating of Gau, Matsya, Sukara, Mahesha and Aja flesh, the mounts of all these, in excess quantity. It's not that, but in excess quantity if you take, eating dried flesh, that is also an important, and putrefied flesh, that is also important thing to get these problems. Eating excessive of Guru Ahara like Parmanam, Paustika Aharam, and Gudam, Dahi, milk, and tuberous fruits. So those things we have to control. Eating very dry and dried vegetables, excessive spices, eating excessive amount of stored food, frozen food, imperfect madhyas, that means totally not brewed liquors, and impure water and viruddhahara. So the foods which are not competent to each other, so such things if you take, that is also going to cause you the anorectal problem. Excessive indulgence in sexual activity as well as in exercise and sitting position, prolonged sitting position and prolonged lying position also causes stagnation in the circulation and thereby the formation of different problems of the anorectal. So other things like leading sedentary life, improper evacuation of stools.
Sir, only 5 minutes is there, sir.
5?
5 minutes remain.
Okay. Go. But I was interrupted.
Because we have limited this session for only 20 minutes for each speaker.
I will pick up, no problem. Injury to anal dermis, excessive passage of stools with forcible evacuation. This is generally happens when the fissures are forming. This thing is generally happening. So in women, due to pressure of womb also, sometimes we get the problems of the anorectal disorder. So this is same thing again, Viruddhahara, Sri Prasanga, Utkadasana and Prushtayana. This Prushtayana we can compare with the riding on the various types of bikes and bicycles. So in that also there is a reason, it's a reason, a good reason to get the piles and other things. Like the Vegadharana, habitual constipation, Mandagini and other mounts, the Mount Sankuras actually forms there and that will be causing the problems. So these are the other, in short, low fiber diet, pregnancy, aging, hereditary, constipation and anal intercourse. That also is the reason for the, and the causative factors for fissure also, as I told you, passing of very hard and large stools by force, they cause the split in the mucous membrane, and due to that there will be formation of the fissure. There are certain other causes like prolonged diarrhea, even diarrhea also can cause, and for us various vapats of basti karma, they also cause. Actually Parikartika is mentioned in the basti vapats. So that is also an important, and Crohn's disease or other inflammatory disorders of the bowel, you will generally get this. So less common causes are the something like diseases like cancer, HIV, or where low immunity will be there, and those also can cause. So cardinal signs of fissure in ano is anal bleeding, pain shooting, like it is called Parikartika because it causes a pain just like if anybody is cutting the anal canal with scissors. That's why it is called Parikartika. And dysuria will be associated symptoms. So low diet fiber, usage of caffeine and spicy foods, it aggravates. They are the risk factors in anorectal problems. One can understand the future formation of arches based on the prodromal symptoms, that is Purvarupas. So quickly we will go through the Purvarupas. So people generally they come not with the anorectal symptoms, but they can come with Anna, Ashraddha, Kruchapakta, that means difficulty in getting digested, Amlika, Paridaha, burning sensation all around, Vishtamba, that is constipation, Udgara, that is sore erectations, like that. So these symptoms, if you find, you have to think of a anorectal problem is going to happen there. And in Bhagendra, particularly, the causative factor is a infection, in the cryptogranular glands, and once the infection forms there, it comes out and forms a pidaka or a small abscess. Sometimes the abscess actually it dissolves automatically, but in many cases, 50% of cases, those abscesses will go through form the Bhagendra or fistula in anal. Actually, Bhagendra is a artificially formed tube from the anal canal to the surface, and which is filled with pus and all the debris, and it will be 100% painful. And all the modern techniques of surgery, they they definitely fail. They may cure that point of time, but again there will be recurrence. In 70 to 80% there is recurrence. But we find that in Chara Sutra there is 100% recurrence rate is gone, and that is total complete cure of the fistula will be there. And this procedure is an ambulatory and a daycare procedure. So some of the pictures I want to show. In piles, we generally grade them, grade 1, grade 2, grade 3, grade 4. In grade 1, they are only internally placed, but if you come to the grade 4, they come out like this. So picture, you can see for general public also, and for the beginners, you can understand how the piles, vessels, the veins are formed there, and they are prolapsing from the rectal orifice.
Sir, please conclude by 2 minutes.
No, you have to give me, because already
As per the organizers, we are following the time. It's not the areas of the speaker.
Arsha, sir, okay, I will just go through the.
Sir, you are telling one and here. What is sir?
Hey, Arsha, no, Nakalu. So this is in one picture. Okay, I will conclude within 2 minutes.
Okay, sir. Thank you, sir. Thank
This
you.
is one picture. So we'll go through the pictures only. You can see the practical. What is that? Puriform fissure canal. Okay. This is fissure canal again. It is simply cut in the anal canal. Here you can see the different types of fistula. So one fistula is just submucosal. This is pelvirectal. This is a fistula with extension. And in one picture you can see that multiple fistulae. And you can see here also the multiple fistulae, the different type of fistulae. So this is the basic picture, how the fistula can pass to the other parts, how the region will form. So you can see a live picture. Here the external opening is there and the probe is being introduced. It goes into the canal like that. So we are applying there with the probe Chara Sutra. The Chara Sutra is tied here. So you can see the multiple fistulae. Here also the another fistula we are just probing. There are both sides. Horseshoe-shaped fistula. This is called Shataponaga multiple. కొంచెం ముందులే ఇక దీని తర్వాత కొంచెం hemorrhoids, causes of blood, because these are the diseases, but the major important symptom in all the anorectal diseases, bleeding from rectum, BPR we generally shortly call it. So there are many conditions, all these conditions, anorectal conditions, they cause some type of bleeding. But not only that, inflammatory colon can cause, colon polyps can cause, even simple constipation also can cause, and colon cancer or rectal cancer also can cause bleeding. So what are the preventive aspects? Actual point is, actually my aim was this. So the preventive, first you have to, where there is burning sensation, apply ice, do the switch bath, keep the area very clean, and some ointments or suppositories are to be done, and lie down in such a position, and later you can see In pregnancy, it's another challenge because in pregnancy, because of the womb, there will be pressure continuously on the rectum and anus, and there is every chance of formation of piles as well as fissures. And these fissures, if are not controlled in proper way, they will lead to formation of the fistula. So this is one technique to reduce the inflammation in the anorectal region, and aloe vera gel, various soothing agents. But that is important, the sitch bath. Sitch bath is a very important thing and a single procedure which helps a lot in the treating the anorectal and in prevention also. So whenever you find some symptom of anorectal disorder, sitch bath is almost, it is a 50% cure of the whole problem. This is the cup of the sitch bath and how patient can sit in the sitch bath. Here also again same. So piles risk for pregnancy is taken here, age, obesity, chronic, lifting of heavy weight. So number one is how we can prevent. Number one is bitter gourd juice. It can treat 1 glass of with buttermilk. So madam just explained about the panchagavyas, but buttermilk is a mother of all other things, and it is also very much important in all the anorectal disorders also. So ripened bananas release the hemorrhoidal pain. Buttermilk, simply buttermilk. Thrice, 4 times or 5 times, you can use instead of water only buttermilk, so that it will be actually controlling. And radish juice is also an important aspect. Radish juice, one can take radish juice daily, twice. So it is also with buttermilk or with some salt or other thing that will use cure. And another important thing is every time for Vata rogas we say that kanda should not be taken. But kanda is very important. Kanda is I just forget the Latin name. So kanda gadda, that is very good for the treatment of piles. Even it prevents the formation of the piles. Kanda gadda. And our classical preparations are there, Buddha Haritaki and buttermilk with Bharangi, Yavani and other things. Buttermilk with singular and with sour or sweet, both can be taken. Many remedies with buttermilk can be consumed in the case of piles. So black cumin seeds, crushed, that's shahajira, crushed, and they are taken with water or buttermilk. That is also a very good thing for. And ati vyayama, ati maithuna, kopam, prustayanam, that is bite, guru aharam should be avoided at least for 1 year to get control over the anorectal problems. So home remedy treatments are available and simple treatments from the doctors. So I will go to that part. Conclusion. This is last.
Thank you, sir.
No, after this I will specialty of Ayurveda. So this is my request to all the students, because it is itself though it is in Shalya, but it itself is a simple and very needed broad specialty. So we can start our practice with the inclusion of these treatments. So that's why I want to stress here. So every graduate of Ayurveda, every postgraduate of Ayurveda should keep ready with certain simple measures and simple treatments in his clinic, and he can flourish like anything, and he will be getting in very short time a good reputation. So Harsha Bhagandara makes a broad specialty of Ayurveda and from among the Mahagadas. Though Besaja, Chara, Agni, Raktamokshana, Shastra, Chilisa are indicated, but these are simple clinical applications are enough. So majority of the cases do respond with Besaja Karma only. So proper medication, they respond very well and they get good treatment by this. In clinics and daycare practices, the procedures of Alepana, Lekhana, Vishparana, that is dilatation, and Ropana. These 4 techniques, simple techniques, if you take up in your general practice, in your clinic itself, so 90% of the cases will be actually treated. Uh, so practice anorectal specialty is a big avenue for all the youngsters and fresh graduates of Ayurveda, which has a high success rate. It is a boon to all Ayurveda practitioners to have such a broad specialty within our reach, in our clinic. Everybody should start that treating these problems with simple techniques. So with that, I come to an end. So I'm sorry I did not elaborate you because of the time constraint, and I'm also thankful to the chair and the reporter and all the organizers, particularly our principal, our new principal, because she is actually dynamic and always behind all these happenings. Thank you very much.
Thank you.
Thank you very much, sir, for the elaborated and comprehensive presentation.